If you're obese, meaning you have a body mass index of 30 or higher, you're twice as likely to have a heart arrhythmia. But you can turn things around. Losing extra weight can make a difference. I'm Jessica Salazar with HCA Midwest Health. Today we're chatting with Dr. Nicole Fearing, a board-certified bariatric and general surgeon with Bariatric and Metabolic Specialists, which is a part of HCA Midwest Health. Welcome, Dr. Fearing.
Thank you, Jessica.
We're glad to have you today. Now, I know we're going to discuss obesity and AFib and how they're linked. So if someone is obese, are they more prone to be diagnosed with a heart arrhythmia, and why?
They are, and part of it's what obesity does to our bodies and how obesity affects the heart. And one of the things that we know that obesity does is it changes the size of the left atrium of the heart. And because it does that, it can lead us to more heart arrhythmias, case in point, atrial fibrillation.
What lifestyle changes do you recommend for your patients who you see with heart arrhythmias?
I think the biggest thing, obviously, for my patients as a bariatric surgeon is weight loss. And any amount of weight loss can make an effect on patients. Even a 5-pound weight loss can make a big effect on somebody's weight and on their health. And so, so we talk about just diet modifications, lifestyle modifications. We always say weight is more than what you eat and how much you exercise. But there are little things that you can do. Just getting rid of the liquid calories in your diet a day, getting rid of the pop, the juice, the milk, the sweet tea, alcohol, those kind of things can make a big difference. Just little bits of more movement every day. It doesn't have to be going out and running 5 miles a day, just adding more movement in there. There are many studies that show that sitting is as bad as smoking. And so if you are in a desk job and you're sitting all day, whatever we can do to get you up and moving more, even if it's once an hour that you just walk around your office, that can make a big difference in your weight and your overall health.
So once a patient is diagnosed with an abnormal heart rhythm, is it too late for them to start a weight loss process or a weight loss routine?
Absolutely not. No, it's perfect, actually. And what we see is that a lot of our patients come to us with a history of atrial fibrillation. Now, we do want to make sure that the cardiologists are comfortable with patients having surgery if the patients are so inclined to do surgery, but it's very appropriate. And what we want to do is whatever type of procedure is going to be the most beneficial to help with weight loss. Now, some people don't want to do surgery and they want to do medical weight loss to help with their weight. And the thing to remember for that is some of those medications can affect your heart, can affect blood pressure, and affect those arrhythmias. And so it's really important to talk with your cardiologist, but also know that there are some of those medications that you won't be able to use to help with weight loss.
Exercise is good for your heart, but if someone with AFib revs up their heart rate, it can trigger the irregular pattern of AFib. How do you ease your patients into a workout?
So I think the biggest thing is what we call prehab, and working with to see, what is the exercise tolerance that a patient has. There's something called a 6-minute walking test that we can do with patients to see where they are even beforehand and how far can they go, what happens to their heart rate, what happens to their oxygen levels as well. And that kind of tells us where people are. Some people, walking is hard. And if you're 100 pounds, 200 pounds, 300 pounds overweight, walking can be hard because for every 1 pound you're overweight, that's 3 pounds on your joints. And so because of that, walking might not be the best thing. It may be something where we work on a recumbent bike. It may be something that we get into the pool. It may be something that we're just doing low level exercise to get people moving. And sometimes we have to do some work with the cardiac rehab folks beforehand to just kind of work on that prehab to condition someone for it. So we try to meet people where they are. But what we find is when you have surgery and you get that first 30 pounds or 40 pounds off, it makes it so much easier and we don't see people revving up quite the same way. And again, it goes back to that, you lose 20 pounds of weight, that's 60 pounds of weight off your knees, which is really stunning.
If I'm living with AFib, how would I know if weight loss surgery is right for me?
So part of it is talking about what's the criteria for weight loss. And so when we talk about criteria for weight loss, we go through what is the NIH criteria. And so currently it's a BMI greater than 35 with associated health problems such as diabetes, high blood pressure, sleep apnea, or coronary artery disease, or a BMI greater than 40. And so if you don't have any of those criteria, a lot of times we'll test you out for conditions such as sleep apnea. And definitely we know that there is a direct link between sleep apnea, weight, and cardiac arrhythmias. And so we really want to test for those things and get them treated if that's the case. If a patient has a BMI under 35, then insurance would say that they wouldn't pay for it, or they don't meet criteria, but there are non-surgical, or pardon me, endoscopic options for weight loss, such as the gastric balloon or the endoscopic sleeve gastroplasty, that some people look at when they have a lower BMI to help get more weight off.
Now, what are the benefits of weight loss surgery for someone living with AFib? What are you seeing in the patients that you have treated?
So I think that there's several things that are important that happen afterwards. One is just their overall feels better, right? You lose, just like I said about that weight off your knees, you lose that 20, 30, 50 pounds, you just feel better. You feel lighter, you feel more energetic. Just moving and walking down the hall is so much easier. And so that makes a huge difference as well. But also we do see in patients that get the weight off that their AFib changes. And for some people, it improves significantly. And so that's another change that people see. The other thing is they sleep better. And so some of those problems with obstructive sleep apnea tend to go away. They're sleeping better. Their diabetes is better if they have diabetes. Their blood pressure is better. So overall, that feeling of health gets better. And I have people just within a few weeks to a month after surgery feel significantly better just with that first bit of weight loss.
Now, you offer several options for patients wanting to lose weight. Tell us about the non-surgical and surgical options that you offer.
Okay, so the non-surgical options are what we call endoscopic options. Those are options where we go down through the mouth into the stomach to do surgery. One of those is called the gastric balloon, and that's where we put a balloon down in the stomach. It's filled with fluid and it takes up space in the stomach, so one can't eat as much. It's only in for 6 months, and then we have to remove it and go from there. The other option is the endoscopic sleeve gastroplasty, again, where we go down through the mouth and we plicate the inside of the stomach to make the stomach smaller so it can't hold as much food. And both of those have some popularity, especially in lower BMI patients as well. And again, they are not covered by insurance currently. So for most people, it's an out-of-pocket expense. Then currently the most popular surgery for weight loss is called the gastric sleeve surgery, the vertical sleeve gastrectomy. And that procedure is where we go in and we remove about 80% of the stomach, leaving a long sleeve-shaped stomach. There's nothing that goes over it. I always tell people it looks more like a banana, but it's not very sexy to say that you had the banana for weight loss. It's better to have the sleeve for weight loss. And people see about 50 to 60% excess weight with that procedure. So if they're 100 pounds overweight, 50 to 60 of those pounds. Some people lose more weight with it. Some people lose a little bit less, but that's the national average. The second most common surgery for weight loss is the gastric bypass. And that procedure has been done longer than any other weight loss procedure in the country. It's been done since the 1960s in various forms. And it's more complex. It's where we cut the stomach and make a new little stomach the size of a hard-boiled egg. And then we reroute the intestine up to that new little stomach. So it works by restricting how much you can eat and decreasing how many calories you can absorb. And with that surgery, people tend to lose about 60% up to 70% of excess weight. And then the duodenal switch is another procedure. It's a little bit newer in the Midwest, but it's kind of like where you do a sleeve on one side of it, and then we do what's called a single anastomosis duodenal switch, where we cut the first part of the duodenum and then bring up a loop of intestine up and connect onto that sleeve so it bypasses more intestine. And with that procedure, it's the highest weight loss of all the procedures that we do, up to 80% excess weight. It has the highest risk with it, But for some people who have really high BMIs of, 60, 70, 80, 90, that may be a good option for them as well.
Now, Dr. Fearing, we are still in the middle of the COVID-19 pandemic, and obesity is a risk factor for developing the most severe COVID-19 symptoms. Why is that?
So obesity is an inflammatory disorder. So the more weight that we carry, the more fat that we carry in our bodies, the more inflammation we have in our bodies. It's also why we know when we carry our weight in our bellies more. So even if we have a lower BMI, but we carry our weight in our bellies, we're more prone to heart attacks, stroke, cancer, and liver issues. And it's all due to that inflammation. So when we already have a heightened state of inflammation of our bodies due to obesity, and then we get COVID, which is an inflammatory condition as well, we don't do as well. So what the studies do show is that weight loss helps. And so we know that patients who go and have weight loss surgery do better with COVID when they're out of their surgical time. Right after surgery, there's risk, but when they get further out and they've lost that weight, it's actually more protective for them. And there was actually a study that came out, an abstract that came out of Europe that looked at kind of cofactors of people who did better than others. And they found that people who had lost weight actually did better and had had weight loss surgery did better.
Thank you for your time, Dr. Fearing. This is a very important conversation for patients to have with their physician.
Thank you, Jessica. Thanks for having me.
Absolutely. You can learn more about weight loss surgery, take a weight loss surgery quiz, and learn about our arrhythmia care at hcamidwest.com.